A big query: what potency do I use in which Sarcodes? Is there a formula? First of all, I want to tell you there is no formula. There are so many different scales in homeopathy. There is a decimal scale, centesimal scale, and there is a 50 millisimal scale, what you call LM potency. And we have more than 20 Sarcodes which I use in my practice, right from adrenaline to pepsinum, pancreatinum to thyroidinum, folliculinum, to much newer kind of Sarcodes like let's say folliculinum or much newer Sarcodes like endometrium. How to choose the potency, how to choose the repetition. The first thing I often ask myself is, what level am I prescribing? For example, I'm going to give you some case examples. If I'm treating a case of acid reflux and I want a remedy as an intercurrent remedy to really help calm down the acid reflux, which means that I'm looking at a remedy like pepsinum and I would want to give it low potency, so I would look at either 6C or 30. I would give it for about a couple of days, wait and watch in next 2 to 3 weeks. So this is what I would like to call as an intercurrent prescription or a phasic prescription. In some cases, you might get some more peculiarities. For example, there is a history of a lot of domination, abuse, and after that, there is a menses suppressed. So there are some symptoms, and this of course remind you a lot of folliculinum. Folliculinum, remember, is a mixture of laccaninum, sepia, this kind of state. And there's a lot of feeling of pressure. So here I've often used folliculinum in 30 potency. I've seen it very effective in 30 potency. Very often in certain cases which I have treated, whether it's case of psoriasis, whether it's case of autoimmune thyroiditis, whether it's some hormonal or metabolic diseases, when I see a very clear pattern of someone who's very chilly, who's very, very restless, who has a lot of craving for sweet, who has a lot of gastric symptoms, who has symmetrical symptoms, who has skin symptoms, psoriasis, putting on a lot of weight, obesity, and a lot of symptoms before menses, very impulsive, desire to do something suddenly, sweating a lot, cold sweat. I'm looking at a remedy, thyroidinum. I've seen very good results with high potency of thyroidinum, 1M, even 10M. Thyroidinum, by the way, is a very good remedy for men's sexual organs, with low sperm counts. I often use very high potency also. Or sometimes I may even use ascending potency. So, depending upon the symptom similarity, you can give the remedy, whether it's even a Sarcode. And based on that, you can choose the potency, you can choose the repetition, and you can then decide whether that remedy is the patient's deep remedy, whether it's an intercurrent remedy or it's a phasic remedy. I hope this helps. I want to invite you for our new course, Nosodes, Sarcode, Bowel, Nosodes, Miasms. Join us soon.